Have order, September 9th, 2025.
Yeah.
At this time, we would ask Mr. Anderson if he will lead us in invocation and pledge of allegiance.
Ladies and gentlemen, if you'll please stand. Gracious Heavenly Father, thank you for the opportunity to live in Horry County. Dear Father, thank you for this room full of people who are working to a better society. Dear Father, we ask for wisdom, patience, guidance. Dear Father, please continue to bless our first responders and all those who work to take care of us. In your name we pray, amen.
Amen.
Attention to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
No public input. Review and approval of agenda contents. I need a motion for you to add that to the agenda.
I'd like to make a motion that we add a resolution recognizing National Day of Remembrance for our homicide victims.
Second. All in favor?
Aye.
Motion carries. And approval of the minutes for August 12th, 2025.
So moved.
Second. All in favor?
Aye.
Thank you. Motion carries. Chief Tanner designating October 5th through the 11th, 2025 Fire Prevention Week.
Well, good morning. So
Yes, sir.
as we do every year, we look for Fire Prevention Week come up in October 5th through the 11th this year with the theme of Charge into Fire Safety Lithium-Ion Batteries in Your Home. We know that's a more prevalent thing every day, with all the batteries all around. Councilmember, you kept asking about battery disposal.
Yes, sir.
We're going to be working with our community members here in the future of how we dispose of those batteries better. We'll start pushing that out as well too, but it is a big issue for us. More and more things every day, more and more manufacturing facilities are starting to use those batteries around, and everybody's home has them now. So that's going to be our theme this year for Fire Prevention Week. Okay?
Excellent.
That's it.
All right. There's a motion.
So moved.
Seconded.
All in favor?
Aye.
All right.
All right, you have it.
Next is a resolution honoring our firefighter EMT Merrick Krzyzewski. We're going to commend him in front of council in a resolution. He had a life save in December 2024 from a house fire. This life save resulted in him being recognized by the South Carolina Firefighters Association in 2025 with a Meritorious Award for life saving in fire service. And so we're going to bring him before council and do that in the next council meeting, so we'll do that.
Excellent.
Okay?
Okay.
Need a motion on that? I'd like to make a motion, we move forward with staff's recommendation.
Second.
All in favor?
Aye.
And one thing that's not on the agenda, but tomorrow morning is groundbreaking for Station 6. Please, we'll be there at Station 6 over at 9 a.m. I'm looking for the time here, 9 a.m. tomorrow morning. It's September the 10th at 9 a.m. I was getting those numbers back in place here, so just make sure we're there at Finkley in the morning. Thank you very much.
Thank you, sir. Appreciate it. All right. And now Suicide Prevention Month. Michelle Smith.
So I'm going to start it out. So just wanted to recognize the fact that Behavioral Services Group is doing a lot of fantastic work, and you'll hear more about that in just a few minutes. And we do want to take a moment to recognize September Suicide Prevention Awareness Month. So I'll let Michelle kind of take it from there, but we do appreciate the opportunity for all to pass this resolution so we can talk about it more with council next week.
So just to reiterate what Ramey said, I cannot thank you all enough for your support, not only on this resolution, but everything that our department has been doing. September is a really big month, and I just wanted to kind of explain some opportunities to show support in different ways. So September in general is Suicide Prevention Month. The awareness colors are going to be purple and teal, so you'll see those sporadically throughout the month. In addition to that, in partnership with the Wellness Committee and Human Resources, we're also going to be putting on a mental health fair for all Horry County employees. That'll be on Friday, September 26th from 10 to 2. And basically, it's just an opportunity for our employees to congregate in one area meet with service providers, gain resources on mental health and well-being. September 10th, I want to highlight, and that is International Suicide Remembrance Day. The color for that is yellow. So if you see individuals across the county wearing yellow, we've been encouraging them to either wear yellow, or we have handed out hundreds of yellow ribbons for those who have strict uniform requirements. But this particular day is really just to encourage the open conversations about mental health, but to also honor those that we've lost to suicide. If anyone is interested and hasn't gotten ribbons and would like some, please see us after. Does anyone have any questions? Okay. Well, hopefully we'll see you wearing yellow and purple and teal and all that. And thank you.
Have a motion?
I'd like to make a motion, we move forward with staff's recommendation.
All in favor?
Aye.
Okay. You want to do it first? Behavioral services.
But let's do this resolution.
Thank you, Mr. Chairman. First off, I'd just like to thank everyone again for their support as we continue to grow and provide additional services that you'll hear more about here shortly. We're very excited about. We also wanted to submit a resolution for council, the National Day of Remembrance for Homicide Victims. The police department feels this is very important to recognize these folks, the victims as well as their families, as well as recognize those victims that we are still working the cases on and supporting those families. And we feel that's important to the Horry County Police Department.
Thank you.
Second. All in favor?
Aye. Thank you very much.
All right, now you have an update, behavioral services update.
So once again, Mr. Chair, I want to lead this off. I just want to say thank you all, council and staff, for supporting what we're doing in Behavioral Services Group. This has been a very amazing journey on a very short time. And it's just, every time we bring this subject up, it just continues to be more and more and more involved with how much this impacts every single one of us in many different ways, all across, not Horry County, but everywhere. And so what we wanted to do today was take an opportunity to update the committee on what's been going on with behavioral services as a whole, individually with the teams that we have in place that have been here for a little while, doing some great work. And then obviously I would be remiss not to thank the chairman once again for getting us down this path 2.5 years ago, bringing this up. And I will say this again, we had no idea how big this was. And it's still growing, it's still getting bigger, but we will be seeing transformational change in this community, already have in a lot of people's lives, but we've got the right people in the right places doing the right work. And Michelle will talk a little bit more about a few additions that we have as well. So just want to say thank you, Michelle and the company, and I'll turn it over to you.
All right. Good morning. I'm so excited to be here. As we all know, I've kind of talked about it briefly, but Horry County government has made unprecedented strides in addressing our behavioral health crisis. I know that we have a long way to go, and we're prepared to do that, but I'm so honored to be here today as we have a great presentation lineup to give you all a comprehensive view of the phenomenal work that a bunch of our departments have been doing. As for the Department of Behavioral Services, we're still definitely new and in our infancy stages, but we're currently truly focused on internal operations and really ensuring that we're building a strong foundation. As we do, we're going to be using the following guiding principles. First, we're going to recognize that lived experience is one of the most powerful indicators, and that's of not only need, but also to measure success. We also all know that behavioral health challenges know no bounds, whether that be generational, jurisdictional, or socioeconomic. We'll also recognize that the true needs of our community is going to be illustrated in their pain and their trauma, and it's our responsibility to transform that into systemic change. As a community, true progress will be impossible without the ability to foster unbiased partnerships that are built on true collaboration. And lastly, we'll recognize that the most profound change is going to come from small groups of passionately driven community advocates and champions. So long story short, our goal is to simply serve as the centralized point of coordination by encouraging county-wide collaboration to truly foster deep-rooted systemic change. I am proud to say that we've recently added 2 new positions that are going to be absolutely vital to us moving forward. Dana O'Brien is our Community Engagement Coordinator, and Julie Meany is our Strategic Coordinator. Once our team is completely onboarded, hopefully in the next 2 days, our goal is to really kind of slow down just a little bit, but just enough to be able to kind of do an internal community needs assessment. Our plan is to meet with service providers, community members with lived experience, and other key stakeholders so that we can really identify our current baseline, but also delineate our immediate, intermediate, and long-term goals and priorities. So despite working on numerous projects behind the scenes, one thing that will be a continuing priority as we progress is advocating for and assisting our internal programs and teams, mostly those funded through SCORF. So as a department, we will not be providing services, but instead we're going to clear the way and tackle obstacles for those who are providing services and doing this great work. I know I've said this before, but if those who are specifically trained to formulate connections to care within our community have to get creative and have difficulty doing so, how can we expect our community members to do the same thing effectively? That's what we're hoping to change. The last thing I want to emphasize is that we are truly just here to do our part and extend the continuum of care by supporting our internal teams as well as our community in whatever that looks like. Right now, our first responders are on the front line saving lives, while our outreach teams and internal programs are trying to save lives and change lives and doing everything they can with what they've got, but hopefully that's only until our department can do our part to level the playing field. So back to highlighting the organizations and departments that are doing the great work. The first presentation we have is going to be Marcus Rhodes from J. Reuben Long.
Good morning.
Morning.
So, the Horry County Sheriff's Office at J. Reuben Long is very proud of the work that our Next Steps team is doing. And our Next Steps team is a collaborative effort of peer support specialists, counselors, corrections officers, medical staff, volunteers, and community service providers. If you look at the networks that are grown, there are people in the room that are working on those teams, but there are more than 60 different service providers, volunteer organizations, faith-based organizations that we now have access to call and troubleshoot, collaborate, and try to figure something out. Our desire, our hope, our passion, our purpose is to restore courage, honesty, empathy, and hope for inmates. I don't know why the last word is missing on the slideshow. I checked it a couple of times, and in some it's there, and some it's not, but that's okay because I think you're going to get the message in just a moment. It begins with courage, that willingness to take a hard look at yourself, a willingness to step forward, and when fear whispers in your ear, the courage to say, not again. I'm not going to do the same thing again. That path is broadened and deepens when there's enough honesty that the individual cultivates from a desire to change, to look in the mirror and see what's really there. Not deny anymore, just to be willing to say what's really there. And then the horizons grow when empathy comes and a person begins to see and recognize and witness the struggles of others. Not just themselves, but the struggles of others. And then it becomes a landscape of opportunity when hope. How many of us in this room need hope? How many inmates at J. Reuben Long need hope? How many people in our community have lost hope? And if we can find a way to restore that sometimes invisible quality, then we can make a difference in these lives. Just some numbers to sort of tag with that. Right now, we have 73 incarcerated individuals in recovery programs at J. Reuben Long Detention Center. There's a waiting list of 138 currently that we just don't have the staffing and manpower and space right now to integrate those programs yet, but we're working and pushing. An opportunity. Chairman Gardner talked about mental health some time back, and it sort of galvanized our focus. So yesterday, we had an opportunity to do something we'd never done. There was a lady that was arrested a couple of days ago, and in her short time at J. Reuben Long Detention Center, we discovered that she had serious mental illness, and she lived in Florence, South Carolina, and she was arrested at a local store in Murrells Inlet, and her car was there. And she was not in a great spot. We called family members. They did not come, did not respond. We located other family members, and nobody answered the phone. So yesterday, out of a result of a lot of the work that we've done over the last 2.5 years, we took her in a wheelchair in our ADA van to her home in Florence, drove her car there, contacted the local police there. They were very familiar with her and helped her get back in her house. That's not the normal thing that a jail does, but it's the right thing when we take care of our people and we do the right thing. So thank you for the opportunity to expand our services and do more in our county.
Thanks, sir.
Excellent.
Thank you. All right, I'm especially excited about the next one. Candy Townsend with Drug Court is next.
Good morning. Thank you for the opportunity to share a little bit about a program that I am incredibly proud of. Treatment Court consists of drug court and mental health court, and it is a licensed treatment facility similar to other agencies you may have heard of, like Shoreline, Waccamaw Center of Mental Health. In addition to me, we currently have a staff of 5 licensed counselors or social workers, 2 case managers, and an outreach coordinator. Our team of 9 facilitate over 30 group therapy sessions, 35 individual sessions, 3 court sessions, 500 drug tests, and all the wraparound services for our clients, which include housing, transportation, and employment needs. And this is every week. What makes us different from other treatment facilities is that we're operated by the solicitor's office, and we only accept clients that are justice involved. So basically, someone has to have a pending charge to come into treatment court. This year marks 20 years of treatment court in Horry County. We celebrated this huge milestone by hosting a special graduation ceremony last month. At that ceremony, we acknowledged past and current team members and agencies that have assisted us in becoming the leading treatment court in South Carolina. The 15th Circuit Treatment Court started out small, but we remained steady, we grew when we needed to, and today we are the largest treatment court in South Carolina. We have seen the most growth these past 5 years, with a 500% increase in accepted clients between 2019 and 2024. For example, during the 23-24 fiscal year, the 9th Circuit, which is Berkeley and Charleston counties, they accepted 24 new participants into their program. The 13th Circuit, which includes Greenville and Pickens, accepted 4 new participants into their program. The 5th Circuit, which is Kershaw and Richland, they accepted 23 new participants. The 15th Circuit, which is Horry and Georgetown County, accepted 248. Not only are we the largest treatment court, we are also extremely successful. Our completion rate last year was 73%, and where counties like Richland and Greenville graduated 7 to 15 people, we graduated 304. At the recent graduation, we also honored a special graduate of our program, Chris Hawker. Chris began treatment court in 2008 and graduated from the program in 2009. After he graduated, we stayed in contact, and one day someone asked me for a graduate that might be interested in speaking at a recovery event. I reached out to him, he agreed to speak, and at that event, I listened to him share his story, and I was reminded again of how far he had come and how much further he could go in this line of work. I approached Solicitor Richardson with the idea of hiring him as an employee with treatment court. At that time, it was almost impossible for someone with a criminal history to be employed as an Horry County government employee. Solicitor Richardson advocated for him to be given the opportunity, and in August of 2017, we were able to offer Chris a full-time position as a peer support specialist. Being able to offer him that position to our team was and continues to be one of my proudest moments over the past 20 years. He represents the true purpose of treatment court. He reminds me, our team, and our clients that change is possible. We are currently in the process of hiring 2 part-time peer support specialists because, like what Michelle mentioned earlier, the value of lived experience is so important, especially in our line of work. So that is something that we're looking at expanding. Supervising those peer supports is going to be part of Chris's job. Over the past 20 years, treatment court has been able to change the criminal justice system in Horry County and offer a real alternative to incarceration. The pictures that you guys have seen represent the over 1,200 clients that have graduated from treatment court since we started in 2005. It's impossible to know how many lives have been forever changed by the better because of this program. So again, I want to thank you for your ongoing support these past 20 years. We appreciate it. Solicitor Richardson appreciates it, and thank you.
Thank you.
All right, so next up we have Sergeant Calderwood with the Crisis Intervention Team with Horry County Police Department.
I want to thank County Council for this opportunity, as well as Director Webster, working with Director Smith, Chief Linhart, and Chief Wyatt. Our team started last April 8th of 2024. That first year, we thought 800 people in a year, it's not bad. We'll shoot for that. As you can see, from September 1st of last year to August 31st, we saw 4,113 calls for service. We're expecting that number to go up. In that time, 2,647 people, individuals, came in contact with our counselors. We've been at, you can see 2,995 different addresses. We've connected approximately still about 30% of those people to services. Services included outpatient, inpatient services. We've tracked the number of arrests when our individuals are on scene, and we're starting to see a reduction in those. As you can see, the numbers spike. A couple months ago, we've seen about a 20% increase in calls since May of this year, and we're thinking those numbers are going to stay closer to 400 a month than it was around 300 a month over the past year. Our busiest precinct is our South Precinct and our North Precinct. We're being dispatched quite often, more than they are doing follow-ups. We do have a 5th person on board, and she's going to be going back through our records and doing more follow-ups to make sure that people that we have connected are staying, as well as those that we just gave information to, like you have in front of you, the green cards, see if they've actually used them to get connected so that we can start increasing those connected to services numbers. We went through and did the blue forms in front of you, which is the same exact form, but in Spanish because of our large Latin community. And those have been handed out quite a bit as well. Through this time, we've had numerous successes. One of our bigger ones was last May 2024. Our unit was called to the Highway 22 overpass for an individual that was suicidal. Speaking with Jay, he, up on that bridge, said, nobody can help me with everything I need. There's nobody that can put it all together. Yeah, you can send me around to different places, but how can I get all this done? I don't have the ability to do it. He was unhoused at that time. Since that time, We've got him in medical care, psychiatry, he's taking his meds. He's in an apartment where now he's working to help pay for that. So now he has rental assistance, plus he's paying for it. And he's got constant flow of food coming in with the food assistance. Jay did stumble this past December where he was arrested for a DUI. Since that time, working with his psychiatrist, he recently tested clean for any substances. He's now looking for a second job, but it didn't take all of our community partners to get there. It did take a community member that stepped up, a business owner stepped up, who knew Jay, and said, what can I do to help? He's become an accountability partner for Jay, and that's been tremendous. We get constant updates, finding out ways to do different things for him. The other success highlights how all three of your Horry County Public Safety divisions are working together. We had 28 calls with C since May of this year. He's a substance user, and he has some mental health, but it's hard to find out what that mental health is because he's on his substances. He's had multiple arrests. We've connected him with outpatient services, and we've also sent him to inpatient. They don't seem to be connected. He says he wants help. Well, when he was in jail up at J. Rubin, we worked with our harm reduction team and said, hey, he wants to go to a 28-day program. Can you help us out with that? They connected us, found a bed, got him registered. Now we had to get him out of jail, right? So we went and spoke with the judge, requested a PR bond with the condition that he go. And within several hours, he was released, put in a vehicle, and sent down to that treatment facility. This past weekend, we had the same type of thing. Person was at the hospital, wanted treatment, contacted harm reduction, said, hey, can you help us out? They helped us out. So we're working very well together. Up there at the jail, being able to check on folks that we've been working with to make sure that when they come out, we're reconnecting with services. Looking at our future, again, those numbers are going up. We are adding more people here soon. Looking to add another one so that we can have like 2 people on shift at one time, and so that we can increase our follow-ups, as well as we've been in discussions about both the harm reduction and the CIT getting on a case management type software, so we're sharing the information so the communication back and forth becomes a whole lot easier. Thank you very much.
Thank you, sir. Excellent.
And last but not least, we have Horry County Fire Rescue's Harm Reduction Team, and Christian Edwards will be given an update.
Good morning. Again, so introduce me. My name is Christian Edwards. I'm the supervisor for the Harm Reduction Team for Horry County Fire Rescue. As my title slide aptly says, Public Safety Update. So that's what we're here to do today. First, I want to thank Council, Director Webster, Smith, HCFR command staff, and all our public safety partners for all the support that we're getting. And I will definitely agree with Scott that we are working well together between all of us, and it really makes it what we're trying to do as a whole and as a county work and get things done. So it's been really amazing to see. Let's see. Ooh, it didn't all come up.
Click it again.
Hit it again?
Yeah.
I'm gonna have it all on there. There we go. So the Horry County Fire Rescue Harm Reduction Team was started basically to reduce overdose death, substance use, and co-occurring mental health disorders in Horry County. So we do this in a lot of different ways. So these are some of the strategies that we use. So prevention through education, which we do that through conducting Narcan trainings, different prevention educations to groups as well as to individuals. I wanted to highlight something. So about a year ago, we actually did a training with all the Horry County libraries, all the librarians. They meet, I don't know if it's annually or semi-annually, but we were able to get in front of them, do a training, and then we actually stocked all the libraries in the county with a few different safety packs that have Narcan, resource lists, things like that. So Station 3 is in Bucksport, which is connected to a library. We had a ride up. I would think they were coming to the station to get help, but there was someone overdosing in the car. Station 3, they were out on a call. There was no one there. They ran into the library looking for help, and the librarian was there with Narcan, was able to actually treat the person and bring them back. So pretty amazing, situation that we had there. Safety kit distribution for risk reduction. So basically providing these safety kits that include Narcan, fentanyl, and xylazine testing supplies, as well as resource lists. So sometimes we might not have the time to actually be sitting down with all these individuals and taking that time, or maybe they don't want to talk with us at length at that time. But we are able to give them these kits so they can, actually take care of it themselves or give it to someone that's in need and contact us at a later time. Community partnerships. So like I said before, working in conjunction with community providers, especially our public safety partners, crisis intervention team through Horry County PD, next steps at J. Reuben Long under Director Rhodes, the coroner's office, and treatment court as well. So just a lot of coordination between all of us. We help with insurance attainment. So we'll sit down with people that don't have insurance and might need it to be able to get into treatment, whether for medical needs, mental health needs, behavioral needs, and we'll help them find and actually attain marketplace insurance. So that's been huge. When we actually go out on a call, a big thing of what we do, so we like to call ourselves treatment coordinators. So we complete assessments and treatment plans tailor-made for the patient's specific needs. We work with the patient and often their family on gaining entry into a program or facility. So these treatment plans could range anywhere from helping someone get into individual counseling sessions, detox and long-term residential treatment, helping coordinate outpatient and medication-assisted treatment programs, which would be like Suboxone and methadone, things like that, or even getting into a halfway house. We help the patient navigate interviews with the facilities, coordinate entry between the facility and the patient, and even help with transportation. So the last thing is handle with care notification we've talked about, and we're going to start kind of trying to expand. So these are notifications if a child, so if one of our crews, or hopefully we're going to get into PD and spread this out, but say a child is involved in a traumatic event. That could be a car wreck, it could be a domestic, it could be, we've had a lot with the coroner's office where a parent overdoses or a parent passes away. We coordinate with the Horry County schools, basically just to handle this child with care. There's no type of information given as far as what's going on, what the traumatic event was, just that, you know what, something happened with this child, so let's be looking and make sure that they're okay over the next couple days and weeks. So hopefully we can get that spread out and through our public safety partners as well. So since the inception of HCFR's harm reduction program, we are proud to announce remarkable achievements in linking individuals struggling with substance use disorders to essential support and treatment services. Community outreach, prevention, and education are the cornerstones towards building lasting relationships within our county. So some numbers, since we started, 1,597 individuals engaged through individual follow-up. So that would mean a lot of what we do is follow-ups from our crews going to see someone, and we go through our electronic health record, and there's certain keywords like Narcan, overdose, substance use, alcohol, whatever it is, or certain medication that's given. We then give those to a team member. They literally go out to that house and follow up, knock on the door, and try to make contact with that individual. So that's what that number represents. 2,834 individuals engaged through harm reduction outreach. So we participate in a lot of outreach events, so community events, trainings like I talked about that we do, Narcan trainings, things like that. 1,682 doses of Narcan given to individuals. So that number does not represent what Horry County Fire Rescue gives as far as through an ambulance or anything like that. That is from our team that has actually been given either by our team to an individual, or we actually provide leave behind Narcan kits on all of our apparatus. So if they encounter on a call someone that may be overdosed and then signed a waiver, we can leave them with a leave behind Narcan kit. Or even if they just mention something about substance use, or they want it, or do we have Narcan, we're able to leave that with them. We're averaging about 25 individuals per month being referred and connected to substance use disorder treatment. So a lot of these cases, some are easier than others, but some definitely take a lot of work, but ultimately I think we're doing pretty darn good. Let's see. I wanted to touch on something that's pretty exciting, hopefully in the near future. We're hoping to initiate a mobile medication-assisted treatment program. So this program could help facilitate medication-assisted treatment care for those people by providing access to buprenorphine, or you might have heard it called Suboxone, by one of our 2 paramedics on the harm reduction team, whether after an overdose call, self-referral house visit, or even upon release from J. Reuben Long. So basically how it would work, a harm reduction team paramedic responds to referrals or other unit stations, self-referrals. We're even talking about maybe a QR code that people could actually contact us. The patient would be assessed and counseled on the medication and treatment plan. If the patient is agreeable, the paramedic will dose with buprenorphine. A next day appointment would be provided depending on availability to a local treatment provider. So we've actually already worked with some local treatment providers in the community, and we've got 2 on board right now that are more than willing and excited to kind of connect with us. So we'd literally be able to have one of our medics dose this person on the medication, and then give them an either same day or next day appointment to one of our local treatment providers. So, and on the right there is just kind of a workflow of, I know it's hard to see, but basically of what our medics would be doing, whether they would actually qualify for the medication or not. So to be able to initiate this program, Horry County Fire Rescue has been helping lead the charge on getting Schedule III authorization for South Carolina paramedics with the help of Prisma Health, the Department of Public Health, and our federally elected officials, including our district's House Representative Russell Fry. In the works, so hopefully hiring 2 additional positions due to an increased success and need for the harm reduction program. We plan on hiring an additional harm reduction specialist, as well as a team lead position to oversee the daily operation of the program. Increased prevention and education efforts. So thanks to all the hard work of our public safety partners do, we've recognized the trust that our community instills in our team, and we really don't want that to go to waste. So we plan on ramping up prevention and education efforts in the form of advertising campaigns, outreach events, and working more on the education part of prevention work, especially with children. So if all goes to plan, we will be part of a countywide effort with Horry County Schools and their school resource officers to provide an approved education and prevention program to middle and high school age students. And finally, we will continue to build and strengthen relationships within the community with an increased emphasis on the school system, other state, county, and municipal agencies, but most importantly, with all the individuals within and HCFR as a whole. That's it. Thank you.
Thanks, Christian.
Yep.
So one thing before we wrap all this up, we do have another part of this program working with our CIT investigator, which is Kelsey Metamite, along with the police department, and we have another officer getting ready to come on board here shortly, focusing on youth and juvenile issues, prevention, as well as Project Lifesaver. Matter of fact, Kelsey can't be here right now. She's working with Project Lifesaver right now, trying to getting that program up and running extremely well. If you're not familiar with Project Lifesaver, it's the program where We provide the wristbands to autistic kids or mentally deprived older adults, dementia, and things like that. And when they get lost, we have the means to go out and search for them. I'm going to let the Chief talk more about that program as well. That's one big thing she's taken on, as well as working with the schools, as Christian talked about, and how we're working with the mental health counselors there and trying to get at this, the juvenile piece, to break this cycle. This whole thing is about stop the cycle, stop that revolving door. And we figured out if we can get in there early, maybe we won't have these folks visiting J. Reuben Long later on, or unfortunately in a very bad situation, overdosing or those other issues. So, but there's also a part of this that Chief's going to talk about, that when we see not only kids that are part of the issue, but they're also the result of being harmed by the issue. So we're trying to make sure we can get to those kids and give some services to them. A lot of what Christian was just talking about as well. When they're in these situations, it's easy to get overlooked that they need assistance as well. So that's a big piece of what Kelsey's working on as well, and our next person coming on board will be helping us. So Chief, you want to take it from there?
Absolutely. Thank you. Again, what a wonderful opportunity that you get to see this work out in our community. This is a great chance for us as the Horry County Police Department to provide youth services, something that we were kind of missing on. We were very fortunate in the previous to get the SRO program, which I thought was a great start back up program, but now we're able to go a little further. We're looking at those crimes against our youth, protecting our future, looking at how can we do different things in the community as well as in the school system to provide them resources, provide them information, make them aware of the dangers out in the community, and we're super excited about that. The Project Lifesaver program, we've been involved with that for several years. But again, this is another service we're adding on to juvenile services to help with those families and children that are challenged in these areas, so we can help them, give some sense of security, help them through their difficult times, and continue to evolve and grow. And I'd be more than glad to answer any questions you have on any of those programs. But we're extremely excited to, again, provide more and more resources to our community. Okay, and as following up to, as far as our internet crimes against children, again, this is another facet of that that we're working with our local agencies as well. But this is all a part of the juvenile services that we're extremely excited about. So internet crimes against children is another avenue. We all know now electronics are prevalent in our community, in our country, in our world. So we want to help those kids as well that could be exposed to these programs. We're bringing investigators on to the program. With you all support, we've brought on a server to be able to help with this information, to store evidence that we're extremely excited about as well. Any additional questions or anything? Yes, sir.
On the program, we have the, forgive me, is it a tracker?
Yes, the Project Lifesaver, yes, sir.
Their Project Lifesaver, is that the same program that like they have out at Oak Tree Farm
I
on?
believe so.
Okay, cool. So we don't have competing stuff where it's the same
We all
program?
work together.
SOS uses it as well. It's
There you
kind
go,
of the
SOS.
known, yes, sir. It's kind of the
Excellent.
known process or program for those instances. It works well. Works off radio waves.
Let us know if you need more.
Absolutely. Thank you for your support. Any additional questions? Thank you all. Appreciate it.
Thank you. So just one thing to wrap it up. If you didn't get anything from all of this, is how well all this is working together. Absolutely. I told you from the beginning when we started this a while back, and once again, Chairman, you don't know what you started, but we thank you. But
Awesome.
transformational change is happening in Horry County, and I just get goosebumps every time we talk about it. So the lives that have already been impacted, they're incredible, and the lives that will be impacted is phenomenal. And I just want to say thank you to everybody that's involved in this process, especially council for your support. And, you know, this is a program that's going to continue to grow. We've got the right people in the right places to make this successful, and it is showing already. So I just want to say thanks, Michelle, and to all the team that's here and everybody else. So, Mr. Chairman, I just want to say
Thank you, and
so much.
I couldn't say it better than what you just did. It starting with council, putting together this plan, and everybody in this room. I mean, a good example was Mr. C there. 2.5 years ago, he just serves his time and moves on to come back again. That's a great example of the judge, treatment court, the public defender's office, law enforcement, everybody getting involved, get that guy out of bed, putting him in the bed so he can get the treatment he needed, so he could break that cycle. And people say, why am I so concerned about this? Because we got great police officers and we got great school teachers, but they're not trained in mental health stuff. So we need to have the farmers farm, the plumbers plumb, and the mental health people do the mental health stuff. Let everybody else do what they're trained to do. So it's good for that person, number one. But it's good for everybody in Horry County, because we save money, we have more time to do the things we're trained to do, the things we want to do, to make Horry County a better place to live and a better place to work. Thank you, sir. Thank you, ma'am.
I second that.
That's it, Mr. Chairman.
I appreciate it. Thank y'all. We, guess we don't realize exactly what y'all do or how it's all coming together and all, but it looks like y'all performed a great team and doing great work, and we appreciate it. You have your reports in your packet. Is there anybody here to answer a question if you need it? We don't need an executive session. Our next meeting date is October 14th, 2025. Any further business? Being none, we adjourn.
Sir, thank you.
Just to be clear,